Hi there. Welcome to the HealthAnalyticInsights podcast. I'm your host, Alana Esty. I have my master's in biomedical engineering, and I created this podcast to discover a community of individuals who are passionate about the field of health analytics. If this resonates with you, don't forget to follow and subscribe to this podcast, as I will be uploading new episodes bi-weekly. With the Health Analytic Insights podcast, I hope to share information and advice in topics such as health informatics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at healthanalyticinsights@gmail.com, and this email, along with any references discussed during this episode, will be listed below in the show notes. Without further ado, let's get into it. In this episode, I want to talk about innovative tech that I believe will change the future of healthcare. The pandemic, in particular, has spurred on innovation in the healthcare field, especially with respect to medical devices, which can allow for rapid testing of COVID-19. And in this episode, I'd like to describe all the different type of innovative tech I believe will have a major impact. So the first thing I want to talk about are these rapid testing devices. According to the World Health Organization, rapid testing kits detect proteins from the COVID-19 virus in respiratory samples or detection in blood or serum of human antibodies generated in response to infection. So there's been many different companies in Canada scrambling and worldwide to convert their operations to focus on building these kits with advisory from proper government organizations, of course. And if approved, these kits will be used in urgent care clinics, hospital emergency departments, and physicians' offices. In Canada, we are having some issues with very, very long lineups. Sometimes people get in a line to get tested for COVID at 8 a.m. and get their test done by 1, 2 p.m. So it takes a long time. So having these rapid testing devices potentially in the next year or next couple of years would be a game changer and would be really efficient for people to have, especially if you could just go to your physician's office and get tested right there and then. And not only this, having these rapid testing kits has resulted in many different healthcare startups, and there's no telling the widespread impact of these portable devices, not only when it comes to testing COVID-19, but for testing other potential diseases. So I, for one, am very excited about the development of these rapid testing devices and the impact they could have. So another technology that I want to talk about is telemedicine. And for me, like many, this was my first virtual doctor's appointment that I experienced back in March. And it was great not having to drive to my doctor's office, stay in the waiting room, and read some pointless magazine while I wait for 20 to 30 minutes to see my doctor for 10 minutes, and then having to take that time off of work. For someone who is relatively healthy, having the option to speak to your doctor over the phone or by video is really an amazing option. And for many of us who are used to being able to order packages at the click of a button through Amazon or book our appointments online at basically any other company, having the healthcare sector meet the technological world that many of us are living in has been definitely an added benefit. And not only for the everyday person, telemedicine could have huge impacts in rural and remote areas. A recent report indicated that the cost for healthcare per capita in northern Canada, with its largely indigenous population, is double the cost than for the rest of Canada. Telehealth has the potential to reduce this cost by not requiring physicians to travel extensively to these remote areas. Telehealth might be an option for physicians to monitor their patients by video or over the phone, and patients who have chronic diseases such as diabetes or epilepsy. In one study, the CDC Division for Heart Disease and Stroke Prevention used telehealth to reduce heart disease and stroke risk factors in rural areas. And the CDC found that there was an increase in requested services focused on using video conferencing to connect specialists in stroke centers in these more rural areas. And telemedicine is expected to grow at a compound annual growth rate of 16.5% from 2017 to 2023. So we see that there's a lot of research that shows that telemedicine is trending in the positive direction. And in addition to this, with the development of 5G technology, this could help potentially reduce lags and poor internet quality that might occur with telemedicine. So again, that's a really exciting technology that we have yet to even see the peak of. And I think that the pandemic really has spurred on development in this field. The next technology I want to talk about is one that I think is really fascinating and cool, and that is smart hospitals. So there's many hospitals around the world which have taken the approach of building smart hospitals, which are built using the underlying digitized network infrastructure, all for the benefit of patient care. So in Canada, one of the first smart hospitals is set to open in 2021 and will host a fully integrated smart technology system and medical devices which can all speak to each other. So they've given an example of what this would look like. So for example, if there is a code blue that is signaled, this will be alerted through the integrated technology, which will be the vital signs monitoring system. And this system will send a silent alert directly to the critical care response team. And I think that it's great that it will be a silent alert because many of us are aware of the alert fatigue that many clinicians endure due to all the noises from the different hospital equipment that they're inundated with. So this vital signs monitoring system, when there's a code blue, will send a silent alert directly to the critical care response team. And the team members will be wearing smart real-time location service badges. And this will automatically override the elevators in the hospital once they're in proximity, saving valuable time. And at the same time, when all this is happening, when there is an alert signaled from this vital signs monitoring system, this will cause the bed of the patient to automatically return to a flat position to allow for resuscitation once the team members arrive, and the IV pump will stop dispensing narcotics that may cause respiratory depression. In addition, a summary of the patient's medical record will appear on the room for a caregiver's easy reference. And once the response team has arrived, the alerts will stop automatically. This is so cool. It sounds like something Shonda Rhimes would create on Grey's Anatomy, and I can't wait for it to be here in Canada. But it's not just Canada. Finland, South Korea, Dubai, Singapore, and Australia all have smart hospitals or are in the process of building them. For instance, in Singapore, the Tan Tock Seng Hospital had a smart hospital even before COVID-19 hit. And within the hospital, they have something similar to an airport control tower. And this clinical system, focuses on command, control, and communication to manage resources efficiently, support operational decisions, optimize patient flow, and respond effectively to ground situations. So it's basically able to communicate and coordinate hospital-wide operations from this system. Talk about running a tight ship. That's absolutely amazing. And to think that this was all implemented before COVID-19. So I'm sure that this has had a positive effect managing the virus. And I think that with the impact of COVID-19 and its burden on the hospital system, many hospitals might be looking to smart hospitals in the future to integrate technology within their hospitals so they can improve hospital operations and ultimately impact patient lives. And the last technology I would like to talk about is cloud computing in healthcare. So I think similarly as the demand for telemedicine has been accelerated due to the pandemic, I think cloud computing in the future will also grow. So some of the benefits of cloud computing include the ability to transfer clinical data across healthcare providers, so having that interoperability layer, a platform to store and back up valuable clinical data, and the ability to perform predictive and prescriptive analytics on large amounts of healthcare data. So of course, one of the main risks of using cloud computing is the security aspect of storing your data in a third-party server, and the need to comply with regulatory frameworks such as Europe's GDPR, for the protection of personal data, or the US's HIPAA Act for secure data portability. So for cloud computing to really make an impact in the future, it's necessary for these third-party platforms and services to have transparency with government agencies and clinicians as to how long the data is stored, how accessible is this data, what types of data is stored. And I'm sure you listener can think of other questions that these third-party platforms must divulge with hospitals and other critical organizations for cloud computing to really have an impact going forward. There will also have to be some flexibility with both on-prem and cloud-based solutions when it comes to storing sensitive patient information. And that's my wrap-up of some of the healthcare tech, which I really think will have an impact in the future of healthcare. So what are some trends that I'm missing? What have you seen, listener, about the technology that will have an impact in healthcare? Is there anything that I missed? Is there anything that I should add? And what are you excited about seeing? So you can drop me a line at HealthAnalyticInsights@gmail.com. As always, I'd be glad to hear from you. And if you're interested in being a guest on the show, you can also email me at that address. Please follow this podcast if you're interested in seeing more of this content. And I hope you have a wonderful day.